We survived! We admired, we applauded, we laughed, perhaps some of you cried. We loved, we argued, we disagreed, we embraced one another, we apologized, perhaps. We danced, I know certainly Peter Piot danced, and we drank, some of you, hopefully not too much, but most of all, we enjoyed. We enjoyed this meeting. Congratulations, everybody, for enjoying this meeting. If you work at a medical journal, you have a dream, and the dream that you have, and the words have been used already, is that we can have a real global conversation. I love Twitter too, and the closest that I've seen us come to a global conversation is on Twitter. And my challenge to Chris and friends at IHME is we want to publish a global burden of disease study in 140 characters. Can you do it, Chris? This meeting comes very close to a global conversation. I hope you all went to the poster sessions, because if you did, if you looked at every poster, you would have seen data from Nigeria, Lesotho, Zimbabwe, Cambodia, Botswana, the Netherlands, Bangladesh, South Sudan, Philippines, US, Tanzania, Indonesia, Sri Lanka, Mozambique, Brazil, Mexico, Thailand, Chad, Uganda, Kenya, Rwanda, Ethiopia, Colombia, South Africa, Canada, Senegal, Ghana, Malawi, Vietnam, India, and even the United Kingdom. That's pretty amazing. That's pretty global. And that's not taking account all of the oral presentations as well. I've got a few things, formal things to do, and then I have a few thoughts to add. I want to usually at meetings you do the thanks last. I want to do the thanks first. Because a meeting like this does not happen without the work of a tremendous number of people who you never see, and who are behind the scenes and have spent weeks, if not months, and certainly many evenings and nights and early mornings making all of this run so smoothly. So here are a few names. In a league of her own, Kelsey Pierce from IHME. And Kelsey has had the most fabulous team working with her. Erin Milani, Kelsey Moore, Erin Falconer, Brent Christopherson, Brittany Wirtz, Pete Crow, and Bill Heisel. Give them a big round of applause, please. I'd like to give my additional thanks to a few people who I know who have worked really hard behind the scenes. I'd like to thank Michael McIntyre. I'd like to thank Linda Ettinger, because she's Chris's personal assistant, and boy, what a life that must be. And Linda's wonderful. And I'd like to thank Chris himself for his vision for this meeting. So big thanks to them too. And I would also like to thank all of the presenters and poster presenters, because, boy, you made this an absolutely fabulous 3 days. Congratulations to every single one of you. Now, everybody who presented here won. As Chris and Julio said at the very beginning of the meeting, we had many abstracts submitted, and we didn't take them all. We had a fairly tough threshold for what was accepted, so everybody won. And we want to recognize all participants by saying that everybody won. But we also want to go a little further, and we do want to offer a few prizes to say thank you. Thank you to everybody. Now, these 4 envelopes contain no money. Isn't that terrible? But they do contain an email address, mine, and if the 4 people I'm about to mention write to me, it's entirely up to you if you do, then we will arrange for a check of £1,000 to be sent to you. So, I want to say thank you on behalf of all of you to the following 4 people, and we will take each one as they come. And I don't know if they're still here in the audience. But if they're not, then we'll make sure the envelope gets to them. I'd like to thank, oh, I need my booklet. Oh, hang on a second. Has somebody got a booklet so I can immediately read out the title of their talk? Who's got a booklet? No, the abstract booklet. I've got one over here. Wait. This is called drama. Okay, back. So I would like to, because I can't remember the titles of everybody's talk. So I would like to thank Farshad Farzad Far. And Farshad Farzad Far gave a talk on the national and subnational mortality effects of metabolic risk factors and smoking in Iran, a comparative risk assessment. Farshad, are you here? Come up if you are, but whatever, everybody give him a big round of applause. It looks like Farshad's gone back home, so I hope we can find Farshad. I'm sure we can, and we will make sure this envelope gets to him. Our second person we would like to say thank you to is Nicole Johns. And Nicole gave a presentation on the wealth and health of nations, a cross-country analysis of the relation between wealth and inequality in disease burden estimation. Come on, Nicole! Congratulations. You were absolutely fantastic. Really fabulous. Well done. The third person we would like to say thank you to is Francis Obare. Francis Obare is from the Population Council in Nairobi in Kenya, and his talk was on population-level impact of vouchers on access to health facility delivery for women in Kenya, a quasi-experimental study. Francis, are you here? You are! Fabulous, my friend. Well done. Please write to me. Okay, fantastic. Well done. Those are the three prizes for oral presentations, but we wanted a fourth prize. And the fourth prize was for the best, or a poster anyway, that we would like to say thank you to on behalf of all the other posters. It's really difficult to choose out of the many great posters that we had. But I want to select one, which a little team of us have been working over the last few days looking at these abstracts and thinking about which would be best. And the one that we would like to offer this envelope to is Marta Tellez, and Marta's abstract was on the heterogeneous impact of non-contributory pension program 70, I'm not going to say this right, am I? Say it for me. EMAS. Yes, thank you. On nutritional status of the elderly in rural Mexico. Marta, are you here? Yes, you are. Fantastic. That's so nice. Well done. So pleased for you. Look at it right to me. Okay, fabulous. That's just our way of saying thank you to everybody. Very briefly, because you all want to get out of here. 3 quick observations, 3 quick challenges, 3 quick visions. Observations first. Writing in science. Just a month ago, Dirk Helbing from the Swiss Federal Institute of Technology wrote this: if a country had all the computer power in the world and all of the data, would this allow a government to make the best decisions for everybody? Which seems a pretty relevant question for a meeting like this, as we do try and gather all of the data we possibly can and do incredibly clever maneuvers with it, whether they be statistical or computer-based. But the answer to that question surely is no. Because although you might have the best data, and although you might have the best analyses, And although you might make all of that accessible to everybody, although access is necessary, it is not sufficient. Because sometimes too much data can actually be disabling. And often we and governments and others use data as a way of closing down conversations by making our understanding of that data more obscure. Understanding, meaning, is what's as important as access. And I think what we've seen at this meeting, one observation I take away is that the incredible analytic strength that we bring to the data that's been presented here has been shone through a lens of understanding and meaning, which has really helped to throw light on what these data might actually achieve. Which is the second observation, and that's around utility. We have seen time and time again in the presentations and in the posters the utility, the applicability of the data that has been presented here. If you were here at the very opening sessions of the week, Victoria Pillay van Wyck's presentation, for example, from South Africa, using subnational data to compare different parts of South Africa, such as Eastern versus Western Cape, showed beautifully how, by using subnational data at a time of political reform and health sector reform, that information can be highly informative to policy and to people. And that's the third observation, around people. A new generation is emerging in metrics. People like me, over the age of 50, we've had it. We're the old guys, and we're checking out of here soon. And there's a new generation who's coming along. I had the privilege, thanks to Rafael Lozano, of having a really wonderful lunch a couple of days ago with a fantastic team from Mexico. Diana, Christian, Irace, Carlos, David, and Mara. And we had a great discussion about their futures, what they were interested in doing, and what their vision was for the world that they wanted to be a part of, and how they wanted that world to be. And that means there's an obligation on us as a metrics community to think about that generation and not just come here and present and think about publication and all that kind of nonsense. Our job is actually to think about what are we doing to nurture and sustain the next generation. And it's fantastic for me to come and see that we have that next generation here, but I hope that we can figure out a way to work together better to support that next generation, because without them, we're in trouble. 3 challenges. John Grove from the Bill and Melinda Gates Foundation said, I think this was on day 2, we need to up our game, he said. And by we need to up our game, I think what he was talking about was the way we use data and the way we explore data. So that's a real challenge to us, upping our game. Because there's also then another obligation on us, because how do we up our game? We up our game not by doing our work in whatever institution it is, for me, at a journal based in London, but I have to ask myself, how am I working to help build skills in countries, abilities, individual talent, and institutions so that those people, those institutions have their own independence and autonomy to do the work that they need to do. The future is going to be about people. Lincoln Chen put it really well a few years ago in his work on human resources for health. He said, there are no shortcuts. This is all about people. So I have to ask myself, I hope you will ask yourselves, what can we do together to build those people in countries, to support them to do their work? And I think everyone, certainly me, if we publish work, we have to think, how do we partner with journals in other countries to support them? How do you in your institutions partner your institutions, your scientists, so that you leave a legacy behind in the country in which you're working? You support them in some way. Because that then leads to a third challenge, and that is, how do we, through this participatory approach, bring evidence to bear on policy? And that is what all of our panelists were talking about here. How we bring evidence to policy in a system of accountability. And that means participatory, democratic conversations, using that evidence in the institutions that we have in countries. It's all about countries. It's not about us, it's all about countries. And we have to constantly bring our data back to countries. And that leads very quickly to three visions which actually combine into one. First, we really have to measure what is important. There's a wonderful book, or at least I think it's a wonderful book, that's just been published by David Stuckler and Sanjay Basu. It's called The Body Economic: Why Austerity Kills. And this book shows very, very powerfully how policies of economic austerity have had dramatically adverse impacts on health. Yes, the obvious case being Greece, but they are happening in many of our countries today, not only in those extreme examples. But the problem is, we don't measure those adverse effects of economic policies, or if we do, we don't link them back to government policy, and we must. We need to measure what's important, and we need to hold governments accountable for what they do to people. And that is a political task that we do have an obligation to, I think, deliver. That then sets not just in the task for our present times, but as a task for the post-2015 era. And we've just had a great session reflecting on some of that. And the word externalities was used several times in that session, quite rightly. What about the unaccounted consequences of what we do to one another? But there's a slight difference in the way we should be thinking about externalities in the context of sustainable development. Because it's not about us. At least it's not only about us. Because the point of sustainable development is saying that future generations are as important as today's generations. And introducing that temporal context in sustainable development is not something we focused on in the MDG era. So we absolutely have to be concerned about people today, but we have to counter that with thinking about how our actions are going to affect people in the future. So when we talk about externalities, we have to think about measuring the things that are going to affect the lives of people in the future. In a fantastic paper also published in Science recently by Partha Dasgupta and Paul Ehrlich, they looked at what some of these externalities might be like. And they're sometimes surprising things that we haven't talked about here very much. In terms of reproductive externalities, issues around, for example, patriarchy or fostering children. In terms of consumptive externalities, issues around the competitive nature we have to have more and more goods, and how do we measure that competitive nature to consume, and then that sets a norm so that if everybody has a Rolex watch, we all have to have Rolex watches. If everybody has a Louis Vuitton bag, we all have to have Louis Vuitton bag. I mean, this is the kind of crazy competitive conformism we live in, but that's what drives the consumption that leads to species extinction. So how do we measure that? Because we're not measuring it well, if at all, at the moment. And we need to. Finally, Pali Lahola, in a wonderful meeting that took place in Bangkok, the first civil registration and vital statistics summit that Alan and others were at just a month or two ago. Pali Lahola, on his slides, had a lovely little tagline on the bottom of every slide. And the tagline on the bottom of every slide of his was, "The South Africa I know, the home I understand." That's poetic, actually. And that, to me, is a poetic summary of what the metrics community is about. It's about what we've been doing these last 3 days. Because we've been talking about the communities we know, the homes we understand. And that vision for metrics, the idea of knowing and understanding, is an essential prerequisite for achieving, and I'll come back to the first thoughts on Monday morning, it's an essential prerequisite for understanding what we have to do to build societies that can deliver the right to the highest attainable standard of health, that can deliver equity for all, and that can deliver the social justice that you and I believe in. Thank you for a fantastic conference. Please travel safely home, and it's been just wonderful. Please, big round of applause to you.